Okay, so let's go ahead and get started. Assalamu alaikum, everyone. My name is Mohammad Junayed Khan, one of the co-founders of Muslim Podiatry Network. Today we have Dr. Qureshi and Dr. Amjad, and they're going to be just giving some pearls about how to ace your residency interviews, inshallah. So you guys can go ahead and get started without further ado.
Alrighty, thanks a lot for that. Assalamu alaikum, everyone. So thanks for everyone for joining and for MPN for organizing this initiative. So how we'll kind of do this is that we'll go over a brief PowerPoint over most things that are related to the interview process, and then open it up for question and answers and general discussion at the end. We won't go over anything truly academic today, but hopefully you guys signed up for the mock interviews that MPN has offered. And that's where we can go over actual cases and questions and then kind of evaluate you on your performance. And so obviously interviews, as you guys know, is a very stressful time for fourth year students and for you guys with a lot of uncertainty. And we hope that the information presented today can be of benefit to you all. So just prior to beginning, I just want to introduce myself. My name is Rafay Qureshi. I'm a practicing podiatrist in Houston, Texas. Graduated residency in 2023. So last time I was a student I graduated school in 2020. So I'm about 4 to 5 years removed from the interview process as a student. However, I was a part of the process as a resident in terms of selecting students all 3 years of residency. Uzair, would you like to introduce yourself as well?
Uzair Amjad. I graduated podiatry school in 2021. Residency at Yale New Haven in 2024, and now I'm a practicing podiatrist just north of Orlando, Florida. My interview process was a bit different because it was during COVID, so it was all virtual. But now you guys are back in person, which is honestly a benefit to y'all. But we'll have some fun today, and we'll learn a lot.
All right, so here's kind of an overview slide of what we'll be going over today. We'll kind of go over the CRIP process. I know it's a little bit different for you guys now since it's a different location from what it's usually at. We'll go over some interview preparation methods, the different styles of interviews, kind of questions to ask, programs, follow-up and ranking etiquette, what programs we're looking for, and then we'll open it up for Q&A at the end. So just a brief overview of the residency process. So the residency interviews are essentially your opportunity as a student to showcase your knowledge, your personality, your passion, and fit for potential residency programs. But remember that not only are programs interviewing you, you are also interviewing the program to see if it's the best fit for both parties, because you'll be spending the next 3 years at this place, and it'll really dictate your career moving forward. The most important thing to do is when you show up on interviews is you have to dress and act professional. That's very important because you don't want to stick out in a bad way by being either too relaxed or too rigid. Definitely dress professional, but don't be overzealous and kind of outlandish in terms of your presentation. The interview process has a varied level of importance from program to program. It's very different in how different programs value and hold the interview process in terms of their final rankings. Some programs deem interviews as just a formality, and they can be entirely social because they value their month-long externship as an extended interview. However, other programs place a heavy amount of emphasis on your interviews, especially if you haven't visited or even externed there. There are different styles of interviews that programs do. You can be one-on-one, you can be paired with another student, you can be interviewed in a group setting with 4 or 5 other students at the same time. Most often it's kind of a panel discussion where it's just you in front of the director, a couple core attendings, and some residents. And some interviews have rotating stations, so where you will be either paired with another person, you'll be at a station for 10 minutes, then you'll rotate to a different table that'll have a different component of the interview with different interviewers. The interviews can be either entirely academic, they can be entirely social and conversational, or they can be a mixture. I would say most of the interviews are going to be a mixture of academic and social components of the interviews. Small minority of interviews can have a hand skills component. I will kind of go over that in the ensuing slides. And every program is unique. It's very important for you guys to do your research on each program about any unique characteristics that they have or that they offer to residents, and that can help tailor your answers to align with their expectations. It's important to be confident and genuine throughout the whole process, because if you act fake or act artificial or act like someone you're not, interviewers can oftentimes see through that, and that can be a negative on your file. Do you have anything to add, Uzair or Dr. Amjad?
Is fine. But actually, it's a very small world. The way you act in one interview is gonna get back to some friend of some resident who relays it to the program director, who this student did XYZ, and it sometimes can rub people the wrong way, or it could be beneficial for you. But the biggest thing is this isn't your time to shine, but not in an exaggerated way. This is a fundamental thing for a step. For some programs, the interview is a tiebreaker. They may have already picked who they want, but they might have a couple people like, oh, maybe not, maybe them. And if you do really well in your interview, it's that tiebreaker that pushes you over the edge.
No, great points. So CRIP this year seems like it's going to be in Chicago. For the past however many years it was in Dallas. So the setting is going to be a little bit different, but I believe a lot of the components of the interview is going to be similar. It should be held at one single hotel. The location can be kind of odd because sometimes your interviews are going to be in actual hotel rooms, but oftentimes they're going to be in large suites and small to medium-sized conference rooms. But it's going to be a pretty stressful environment. A lot of people are going to be walking around. There's going to be a lot of tension in the air. It's important for you to kind of block that out and make sure you're focusing on yourself and kind of tune out all the outside noise, tune out all the gossip that's going to be going on, and really just focus on yourself and your performance. A handful of programs do their interviews outside of CRIP. They'll be scheduling that with you guys on a personal basis, likely on site or over Zoom. Just some general scheduling tips. You want to schedule some time between each interview that you do. You're often going to have like 5, 6, sometimes 7 interviews per day. Definitely schedule some time in between to travel from room to room. Sometimes these elevators in these hotels can be running really slow, and sometimes the interview process can be running slow or late as well. So you want to make sure you have enough time between each interview to get to one place from the next. And if you have like a top 2 or 3 programs that you're kind of gearing yourself towards, hoping to land, you want to make sure that they are not at the very top, as in they're not at the very beginning of your interview process or not at the very end. This is important because you want to have a couple interviews to warm yourself up, to kind of see what the whole process is like, because there's going to be a lot of anticipation when it comes to interviews, and you don't want your top program to be your very first interview. You want to get a couple practice interviews out of the way, just so you get your nerves and your jitters down, so you can perform your best for your top programs. And you also don't want to do your top programs towards the very end, because oftentimes you can burn out by doing sometimes 10+ different interviews. And in terms of how many interviews you should schedule, that's kind of dependent upon you as a student, depending on your comfort zone and your interest level. I would advise against scheduling just like 2 or 3, even if you're confident that you're going to land at one spot, despite if you've been promised a position at that program, because unfortunately a lot of programs do bluff and they do lie, and they'll promise spots to students more than the spots that they have. So you want to make sure that you don't put all your eggs in one basket and just go off of that. And you also don't want to schedule too many interviews, because the interviews at the very end, if you're doing like 14 or 15 different interviews, you're going to be pretty tired and burnt out. You can let your guard down, and sometimes your level of professionalism can falter at the very end of the interview process.
just to build off what Dr. Qureshi was saying, the programs will hedge their bets. They will tell multiple people you're our number one or you're on our top and stuff like that, just to make sure that they fill all their spots. And this is more common for quote unquote the big name programs rather than smaller programs. So if a program is telling you something, take it with a grain of salt, because you don't want to be that horror story where you just interviewed with two people, don't match anywhere, and now you're scrambling. There was multiple kids in my graduating class that they started paperwork for residency places and then didn't end up matching there.
Absolutely. Everything that he said is pretty accurate and was reflective in my interview process as well. One last part about CRIP is that along with the interviews, you'll have some socials that these programs will organize as well for the interviewees. If your top programs are hosting socials, it's important for you to show face, definitely attend and mingle and talk to these directors and residents to make sure that you do demonstrate your level of interest. Oftentimes they do have like alcohol and stuff. You want to make sure you obviously can stay away from that. Maintain professionalism at all times, even if it's in a social setting. You don't want to slip up, because oftentimes programs can judge you based on your social interactions at these socials as well. But I know sometimes you'll have multiple different socials kind of at the same time that these programs will schedule. They're understanding of the fact that you may have to leave early to attend different socials that other programs may be hosting, but still make sure to at least show up for a little bit, show face, and then go to the next social to have your boxes in line. Do you have anything to add for, I guess, the social component of CRIP?
Well, I was like virtual, so I didn't really go through the social. We had virtual happy hours and stuff like that, but it's just they're just trying to feel, can they hang out with you for 3 years when they're not at work? But yeah, just be yourself and be professional at the same time.
Absolutely. So the interview process can be a little bit different for places that you've externed at or have just visited, or places that you're just applying and interviewing for. For places that you've externed at, these places likely know you relatively well already. So this interview may be a little bit more social and just to get to know you and get a feel for how much interest you have in that program and how much interest they have in you as a student. Because essentially your externship may have served as a month-long interview. However, you still do want to take this interview seriously and be professional and make sure you perform to your highest capabilities. Places that you've just visited once or twice, they're likely going to be a little bit more academic, I would say. And if you're highly interested in the program that you've only visited at, if you weren't given a chance to extern, then find a way that you can set yourself apart from those that have externed. Because they're already going to know their externs pretty well, and they have to know you, and they have to know you to the point where they're going to rank you higher than them if you really want to end up at that spot. And for places that you're just going to be interviewing for, you want to make sure you do your homework and be knowledgeable about the program. Go over the website, make sure you know the details of the program, attempt to reach out to either current residents or upper years who may have interviewed at that program to gain some insight. Anything that's publicly available about those programs, they can potentially ask about to make sure that your interest is genuine for those places, and have an answer of why you would potentially want that program without having spent a month there or visited. So in terms of preparing for interviews, you guys probably know better than me, because me and Uzair are 3 to 5 years out from being a student. So I'm sure the resources have changed and they're more up to date now. But regardless of when the interviews are, mock interviews are going to be your biggest resource. There are a bunch of different files out there that have mock interview files that you can go through and practice with your friends and your colleagues. Definitely try to make your own as well, because that'll really solidify the information if you're making these questions and making these cases up by yourself. Definitely practice out loud with other people. It builds confidence. Try to practice with multiple different people to get different perspectives and constructive feedback. And it also helps you with the timing and conciseness of the answers that you're going to be presenting during your interviews. Prism, I'm sure nowadays still is probably going to be a really good source, I would say, for interviews. It has a good overview of all the common pathologies, a good sample of social and ethical questions, and it references landmark articles pretty well. There are a bunch of other websites that are out there nowadays, and case workup and rapid fire documents and Quizlets that are assuredly helpful for you guys. And finally, just be aware of any research that the director or the program has published. Stuff that's been cited pretty often or that's been recently published, you want to be aware of that, because those are often questions that they can ask interviewees in terms of determining how interested candidates may be in their program. Do you have anything to add regarding preparation material?
If you have a question about, where should I read some of these landmark articles, ACFAS has a breakdown of pretty much all of them and links to the actual articles. So if you ever want to prepare before, I want to read the articles by Coughlin about hallux rigidus or something like that to have it back down. They're all on ACFAS's website, broken down into categories.
When it comes to the case workup, that's going to be a big component of you guys' interviews. Vast majority of programs will go through, cases and have you go through them from start to finish. The most common cases, I'm sure you guys know, are going to be diabetic foot infection related, trauma, open fractures, compartment syndrome, first-rate pathologies, the common pathologies that we kind of see and you've learned about. Also, don't forget about pre-op and post-op considerations when you're going through cases. These programs want you to be knowledgeable about making sure patients are NPO, certain labs to order, antibiotics to give, post-op protocol, non-weight bearing status or weight bearing status, DVT prophylaxis, etc. You want to make sure to be systematic. You don't want to be jumping all over the place. So definitely go through the case from start to finish systematically, going through from HPI, asking about their histories and their medications and allergies, and moving on to vitals, physical exam findings, imaging labs, and going on to diagnosis and treatment options. Definitely, you should practice multiple times, by yourself or with your colleagues and friends, just to get the flow down of working up a case from start to finish. When it comes to rapid fire, this is also going to be a pretty common component of a lot of interviews. So the common topics that you should definitely know going into the interviews are, anatomy. Like if you're going to get an anatomy question wrong, that's going to be something that programs are going to look down upon, because that's something that should be ingrained in your knowledge by this point. You want to know about antibiotics. You're going to be prescribing a lot of those, and especially when you're on call at these hospitals during residency. Common antibiotics for certain conditions like MRSA and Pseudomonas, preoperative antibiotic considerations, different microorganisms that can cause, diabetic foot infections. You want to be familiar with lab values, common cutoff rates for certain labs that raise your suspicion for, certain pathologies. SIRS criteria, Lyrinx score. You really want to be good with your X-ray and MRI reads. Definitely know your radiographic angles, what's normal and what's abnormal. Contraindications for certain treatments. Suture materials, something that they can be nitpicky and ask about as well. You want to know your differential diagnoses, and certain questions that I found were common on my interviews were like stages of wound healing, stages of, bone and tendon healing, skin graft healing. You kind of went over kind of the landmark articles. You don't have to memorize every single one, but you should have a relative baseline knowledge of the articles that are repeatedly referenced, throughout externships, throughout your review material, and throughout your coursework. Very important is that if you don't know an answer to a question, make sure not to guess or make one up. It's important to remain calm. It's okay not to know every single question. Oftentimes, programs are going to purposely ask you some ridiculous, outlandish questions that they don't even know, the residents don't even know. They just want to see your reaction, to see if you panic, to see if you are going to guess, or if you acknowledge that you don't know the answer, and then you express desire in learning more about it, and then you show humility in that process. Anything to add there about casework?
If you're at a program, you'll pick up on some questions attendings ask residents, and those questions will 100% be asked to you, especially if you extern at that program. Every attending has one thing they really, really like. If it's MPJ fusions, Achilles tendon repairs, and if they're in that interview process, that you can bet $1 billion that they're going to ask you that question. So if you extern it, just pay close attention, or think back to what they were doing in those bigger cases, or any of those cases, and what questions were they asking residents, because they will ask that to you.
Yeah, and hopefully you guys as students have been taking notes, while you're on your externships, about questions that you've been asked, because they can always come up again during your interview process. There's also a good habit to jot down some of your most favorite experiences during your externships, because that's something you can refer back to when you interview at these programs, and really show that your month there was memorable and impactful. So social questions, a lot of programs will have social questions as well. These can range from your, kind of basic questions that you're going to expect in any interview, like, tell me about yourself, anything related to your personal statement or your CV, especially at programs that you did not extern at. You can expect questions about that. So make sure you're knowledgeable about everything that you put on your CV and your personal statement. Other common questions are going to be, about strengths and weaknesses. Weaknesses, if you're going to talk about that, make sure that you transition into how you're working on that weakness to overcome it and turn that into a strength. What you're looking for in a program, you want to have a specific answer for that. Don't just get something that's generic or vague, because you want to stand out in these social questions in a positive manner and be memorable to these programs. Where do you see yourself in 5 to 10 years? That kind of determines, if you have any certain long-term goals that may potentially align with the programs as well. Any challenging situation that you've been in, either during school or in your life, and how you handled it, because you're going to be placed in a lot of different difficult situations during residency, and they want to know that you're someone that can overcome these obstacles and still perform. And various other just, random questions just to get to know you, your favorite hobbies, what animal you'd be, your favorite bone, your role model, etc. These are just a few examples of many that they can ask. Prism has a good, layout, as well as some of these review websites that are out there nowadays of potential, social questions that programs may ask during the interview process. So certain programs will also ask you some ethical questions. These are probably in the minority, but they still do exist. So you want to be aware of that. These questions are essentially largely meant to put you in stressful situations and assess your thought process and your reasoning skills. And they want to make sure that you're putting, the patient first in all circumstances and all instances. Some examples can be like, if the attending tells you not to report a certain complication or something that happened during a case in your op note, like what do? You know inherently that's wrong, but what do you do in that situation? What do you do if another resident is, possibly a victim of domestic abuse and is not speaking about it? How would you handle that situation? And some places, minority of places, will ask you just random questions to throw you off, like about politics and about the government. They're just trying to essentially see your reaction, hope that you maintain your composure, that you don't panic. You come up with an answer. It honestly doesn't matter what answer you come up with. They're not judging you on your, political opinions or anything, but they just want to make sure that you have a clear thought process and you're not going to stumble when you're answering. And essentially, you want to make sure you follow the chain of command in all these ethical type of questions that they ask. If they're going to ask a question about a certain situation that may arise during residency, you want to make sure you go through the proper channels. Like go through, if you're a first year resident, you want to go to your upper year residents first. You want to go to your chief resident, and before you go to your director. So they want to make sure that you have, your chain of command in line, because they don't want someone that's going to panic and do something that they may not expect, especially in a situation that may be a very difficult situation that happens during residency. This is not meant to scare you. I mean, I know these kind of questions can be intimidating sometimes, but majority of programs don't ask ethical questions to this magnitude, but you do want to be aware and make sure that you're just maintaining composure and have a proper sense of reasoning when you're giving these answers. Make sure you always put the patient first and do the right thing. So hand skills, a minority of programs will have a component of hand skills in their interviews. Although it may be a minority, it's still a definite possibility. So you want to be aware of this. They can be something as simple as, suturing and hand tying, which is something that you should honestly expect and be expected to do. And then there may be just some random things where they're going to ask you to play some games, assemble like a external fixator, fly a drone, play cornhole, like do a bunch of random things with your hands. And at the same time, they may be asking you, social questions and academic questions at the same time. These are essentially meant to just assess your ability to multitask and handle different pressure situations and make sure that you can do multiple things at once without essentially panicking. I guess you didn't have any hand skills because you were on Zoom, right? There. So, yeah, all these examples that I mentioned here on the slides are either ones that I've encountered myself or I've heard from some of fellow students during my interview process, so that different programs have made them do. So these are all realistic.
Another one they used to do, like I've seen, it was like make a paper airplane, then see how far it goes, and they just ask you questions. Most of these hand skills, he's right, it's a minority of people. Programs do it, but the programs that do it actually are really will actually take it into account on your teachability and whether or not they have to teach you a lot versus a little bit.
So at the end of your interviews, most of them are going to give you an opportunity to ask them questions as well. So always have like 2 to 3 questions ready to ask at the end of the interview for each interview that you undertake. Remember that you are interviewing these programs as much as they are interviewing you. So you're not just trying to desperately get that program. You want to make sure that that program is the right fit for you, because even if a program may be, universally thought of as like an amazing program, it may not be the best fit for you based on your personality and based on your outlook. So just because everyone's talking about a certain program being amazing, it doesn't mean that you have to do your best to try to get that program, because you want to make sure it's the right fit. It's the right fit for you. You can bring up any concerns or any experiences that you had during your externships and kind of tailor your questions based off of that. And if you didn't extern at a program, you want to make sure you don't ask them questions that the answers to those questions are already available, like publicly, like on Google or something. You want to make sure you ask them thoughtful questions that is not something that you can easily just search up on their websites. common example of questions that you could potentially ask them is about any, anticipated upcoming changes that are going to be happening to the program, any increased opportunities that may be present for residents in the next coming couple years, opportunities for research, what qualities are they looking for in potential residents, the balance in their program between like clinic and surgery and academics. And then if they have certain protocols about, if residents are struggling and what their feedback mechanisms are in terms of how they evaluate you. Do they meet with you every 6 months to kind of assess your progress and kind of go over your strengths and weaknesses and how you can do better, stuff like that. You can essentially ask these programs to show your interest. So you've completed your interviews and now it's, you're really interested in certain programs. It's important to follow up with them, and especially do so in a timely manner, like within 24 to 48 hours. Because some of these programs, like my program, for example, even though rankings are not due to like over a month after interviews have concluded, like my program, at least, we at the end of interviews, we immediately kind of made our rankings like the next day. We made sure we got our rankings and essentially finalized them and send them off to CRIP. So if you want to make any sort of last impression after your interview, like make sure to send them a thank you email or a thank you text to the current residents. Kind of reinforces your interest. If you've answered certain questions wrong and you want to follow up with them, that's also a good idea. And get back to them just to show your initiative and wanting to learn and really wanting to show a good impression for these programs to consider you, over other externs or other interviewees. So all the interviews are over, and now it's time for you to, put in your rankings for Casper and CRIP. So there is a certain amount of etiquette and strategy that you have to have when it comes to ranking. And telling your programs that you're ranking them at a certain place. You only want to tell one program, your top program, that you're ranking them number one. You don't have to do so, but it is in your best interest to do so if you really want that program. However, programs are technically not allowed to ask you to tell them where you rank them. They can tell you, but they're not supposed to ask where you ranked them, but you can take the initiative yourself and tell them that you ranked them number one to at least plant that idea in their head that if they rank you highly, then it's going to be a match. It's important not to tell multiple programs that you rank them number one, just to try to cover your bases and see if you can get a program, because word spreads really fast. This profession is very small. And if you tell programs contradictory information, then it's going to get back to them one way or another. Even if those programs are cross country, like word can definitely get around. So make sure you do your part and be honest. And for other programs that you're still highly interested in, but you're not going to be ranking them number one, it's still appropriate for you to tell them that you're ranking them in the top 3 or in the top 5. That's kind of a personal decision if you want to say that or not. But at the end of the day, programs can't force you to tell them where you're going to be ranking them. Also, rank the programs in order that you want to be there, despite how you perceive the interview may have gone. If you think you bombed an interview, and that's your number one program, don't knock them down, a few slots just because you don't think you're going to match there. Like, the system is designed to work in your favor, so it's always going to go through the programs that you ranked first to see if there's a potential match based on how you rank and based on how they rank. And if not, then they're going to move to the next program down the ranking list. So always rank based on how you want to go, not based on where you think you may potentially match based on what other programs have told you or what or how you've potentially done in your interviews. And lastly, just don't rank a place if you cannot see yourself there. Even if you think you're going to potentially scramble, like if you don't like that program and you don't see yourself spending 3 years there, even if you spent a month externing there, or interviewed there, don't don't just rank the program for the hell of it. Like, you want to make sure that that's a program that you can see yourself thriving in, even if it may not be a perfect program, for the next 3 years. Do you have any input to add on, I guess, after the interview process and the ranking process?
I'm a big proponent of trust your gut. If you have a dream of going somewhere, and if you think that interview is kind of mediocre, go with your gut. If you see yourself being there, rank it first over someone else that's kind of telling you, hey, we want you to come here. Because we can plan all we want, but all our plans are written already. So go with your gut, do what you feel right, because Rafi's right. This is in your favor as the student rather than in the program's favor. So huge things. Just keep on going with your gut.
Yeah, and then try to block out all the noise too, because a lot of other students are going to be saying that, oh, this program has guaranteed me the spots, and stuff like that. So don't be intimidated by all the gossip and the noise that's out there. Like, you rank based on where you personally want to go, and kind of block out all that noise, because programs can tell students all sorts of different things. It doesn't mean it's the truth. So there's a lot of surprises that happen, like when match happens, and because a lot of people are either overconfident or they have a misconception of where they might potentially think that they're going to end up. But at the end of the day, you have to, do what's best for yourself, and rank according to your own assessments, and how you determine, what's the best program for you. Yep. So just some basic characteristics that programs typically are going to be looking for is they want someone who's teachable. They don't expect you to know everything right away. That's why it's important not to be down on yourself if you get questions wrong. You just want to demonstrate that you are teachable. You're someone that can learn, can pick up things really fast, and you show initiative. Someone who's self-motivated. They don't want someone who's a lazy resident who's just going to go through the motions. They want someone that they can get along with and they can see themselves working with for the next 3 years, both in a professional and in a social and casual setting. And they want someone who shows willingness to learn, who can add value to the program, and just someone that they can trust to handle their patients at their hospital and in their clinics. And just some final thoughts. Before interviews, like, it's totally appropriate for you guys as students to ask programs and ask residents, how their interview process is like, because you can get a lot of insight from residents or even upper years that have interviewed there in the past. A lot of them will be forthcoming. They'll tell you like what the process is like. Some of them may withhold that, but it's not going to be your fault for asking. And it also displays your interest level if you're going to be asking places that you've externed about their interview process, because it shows that you really care about potentially wanting to be there. Always conduct yourself in a professional manner. You don't want to be arrogant or overconfident. You don't want to badmouth, other students, residents, or programs. CRIP, there's so many people there in one small area. Like, people talk all the time. It's very easy to gossip and say things about other people. But you want to stay away from all that stuff. It's important that if you think that you did poorly or you performed poorly on an interview, like, turn the page very quickly and move on, because you have 6, 7, 8 interviews in one day. You don't want to dwell too much on your mistakes. You want to turn the page quickly and make sure you put on your best performance for the next interview that's coming up. I know you're a student now, but picture yourself as a resident or an attending on the other side of the table, and kind of put yourself in those shoes and see what you want to see from a student. How would you evaluate a student, and what can students do to impress you if you were on the other side of the table? It's important to be yourself and be genuine, and this is kind of your last major hurdle as a student, essentially. Like, once you take your boards and your interviews, you're pretty much coasting the last 5 months of school. So you want to make sure you finish strong, take interviews seriously, and then after that, you did your best. Leave the rest up to leave the rest up to Allah, leave the rest up to God, and then you'll end up in wherever you're meant to end up, and it'll be the best for you. Any other thoughts that you want to add?
No, man. It's just have fun. It's a very stressful time. Find the little enjoyments you can during interviews, and he's right. Just leave it up to God, go with your gut, and inshallah everything works out.
If we can open it up for, I guess, questions now. If any of you guys want to ask any questions or have any concerns, you can type it in the chat box or unmute yourself. Or if you have anything to add, Dr. Khan.
No, I mean, I don't know if the students have any questions, but I have a couple of questions for you guys. So, what were things that you can remember being like, in residency, chief resident, things that made you rank students higher or lower based off of the interview process? Can you guys remember anything?
So my program that I went, we go through every single student in a giant PowerPoint slide. And if the resident did something a bit weird, it gets brought up. Or if the student did something really interesting or really cool or it was helpful, it gets echoed really quickly. There was a couple times where some residents didn't like a specific student and other residents did. And then it went up to the director's decision on whether or not they would be granted an interview or not. But most of the time, most residency are pretty democratic. They get the opinions of the residents and stuff like that will be teaching you during your residency career. So if your residents like you, they will back you to the end.
Mine's kind of unconventional just because my program did not take students. We didn't take externs per month. So our process was almost entirely dependent upon the interview. And then if the students showed interest in the program beforehand in terms of reaching out, visiting, or attending our, academics, because we have monthly Zoom academics. We have a list, like we have basically a folder on each student that basically shows how much interest that they've shown in the program. Did they visit? How many of our Zoom academics on Saturdays have they attended? Do they have any connection to the program in terms of location? Have they reached out to our coordinator or our residents to ask more questions about the program? Stuff like that. In terms of the interview process, a lot of it's based on, at least for my program, it was based on your performance during interviews. Because we value social questions a lot. We value people that, don't panic when they're put in difficult situations. Not necessarily about getting every single academic question right. Our process was a little bit different because we didn't really know the students that well before we got to interviews. So it's kind of not the best method, but that's just kind of how it was for us because we don't take externs.
No, yeah, that's great. I mean, if I can answer my own question, I mean, I can remember times that, someone had a great month on externship and, the interview was supposed to be just like a walkthrough, more like a formality. And we gave them like a walkthrough case or just basic, and then they would just bomb it. And it's like, come on, man, like this is like a very basic, like diabetic foot infection. And if you bomb that, like if you bomb the walkthrough for an externship, like that looks really bad on you. So I can specifically remember ranking people lower because of that. There was another case where it was like a rapid fire section. So we had a little bit more of an involved interview for people that didn't extern or visit with us. And we purposely put in a few questions that you could kind of interpret it either way, like there's no like correct answer, for example. And if you're a student kind of like arguing with one of the residents or the attendings, like that's going to look really poorly on you because those programs just want to see, are you teachable or not, right? And I can specifically remember like, okay, we knocked this person down a little bit. So some programs have like a pre-interview rank and like a post-interview rank. And so that's something that we did. And like you would see some changes based off of some of these things. But yeah, so the interview does definitely matter, and like Uzair said, it's a tiebreaker for a lot of places. Definitely think about it that way. Does any other student have any questions? Because I have a few other questions, but I don't want to just keep asking questions. Anyone else want to chime in for anything? No? Okay, I'll
No
ask
questions, but just wanted to
Okay.
say thank you so much to all the panelists. Thank you for taking the time. I was here listening, but running some errands, so you guys didn't get to see my face. But thank you guys so much. I really appreciate all the insight.
You're very welcome.
You're welcome, man.
So the other question I had was, and this is something that obviously comes up in being Muslim, is some students are like, I have to be able to catch a Jummah, I want my Eids off. And then some people even want to like mention that at interviews, especially if they don't know you. So how do you guys feel about someone who's maybe a little overzealous in that situation? Like, what advice would you give to a brother that says like, oh, I need to have Jummah off and I need to let them know about it?
It's going to be very difficult to find a residency that's going to give you Jummah off. It's going to be tough. I'll be very blunt here. I was lucky enough we had a masjid across the street from one of the hospitals, so I could just pop out and tell one of my co-residents. So it was a handful of Muslims in our program, so they were just cool with it. But there are definitely other programs that they're going to be busy on a Friday, and they're going to look at you like, what in the world are you leaving for an hour and a half for in this charcoal recon? Like, what's wrong with you? It's tough. I would bring up that conversation once you match at a place rather than during the interview process, because that could really, it won't make you look like a team player. That's the biggest concern. And residencies just want a team player.
No, nothing much to add. I mean, pretty much you guys pretty much answered it. It's not something that I would bring up during interviews or, as a student. You can potentially ask some residents that you're comfortable with during the process, like beforehand, like especially if they are Muslim. But I wouldn't bring it up to the director or any other core attending until after you match. After you match, then that's something that, obviously they can't kick you out based on something like that, but they'll do their best to try to accommodate you if they can. But that's something you worry about after you've already matched to the place and you're going to be spending 3 years there. Not something that you going to bombard programs about during the whole selection process, because it doesn't, like they said, it doesn't really make you look like a team player. Even though your intentions may be good, it's just not something that comes across, very accommodating in the beginning.
Exactly, and to be honest, I mean, you guys you're in residency. You guys are doing surgery. You guys are saving lives sometimes. It's okay if you miss Jummah in that situation, right? Like, if you look at it from like an Islamic, fiqh perspective, it's okay if you're busy, if you're tied up in that situation, right? So yeah, I mean, absolutely, that's the advice I would give anyone as well. I know we still have some students here, and I just want to say something that, we have some colleagues and friends who are residency directors and whatnot, and like, I just want to let the students that are here, like, just be professional, man. Like, someone was telling me that you have students that want to leave at 5 o'clock because they only get paid for whatever 8-hour days or whatever, right? So you could be in a situation, and this could be an ethical question that comes up. And I know programs are asking more of these. I know maybe it was not as common maybe 4 or 5 years ago, but say it's 445. You're at a two person a year program. Your co-resident is in a case. The seniors are off site, whatever. And 445, you're trying to leave. Your co-resident is in a case, and something comes into the ED. Well, we have situations where people are like, well, I'm leaving at 5. I'm not staying here. This person can finish the case and see, after they're done the surgery. What do you do in that situation, right? So you're going to be asked, you may be asked things like this on interview, because as a director, I want to see how you're going to respond, because I don't know if this is a generational thing, or I don't want to throw anyone under the bus, but like, this is an issue in residency right now. And I know that program directors are going to inquire about these types of people more and more, right? So be ethical, put the patient first and be professional, right? Even if you have to stay over 15 minutes or whatever, right? So
That exact scenario has happened to me as a chief resident. There was I'm like, it might be 5:55. I know your shift ends at 6. You gonna go see this patient, even if it's nothing. I don't care if this guy's already here. We're not doing that. You're leaving when the work is done, not when your quote unquote shift is over. Like it was definitely. I don't know if it's a generational thing either, but some of these younger ones are like, it's just, and it rubs some older attendings the wrong way. That's for sure. I mean, if an attending hates you or doesn't like you, it's not a fun time for 3 years with that person.
And you guys already alluded to this, but just being yourself is super critical. I mean, I know of some sisters that hide the fact that they're married or have kids or have a family because, or that even that they're married or engaged, whatever. And yeah, you guys were all residents, and behind closed doors, people have certain discussions like, oh, we can't have too many girls at this program; they're going to get pregnant and be on maternity leave. Or we can't have too many Muslims; they take Fridays off. Or the Orthodox Jewish, the Sabbath comes on Friday. These are conversations that happen behind closed doors, right? So honestly, you want to be yourself, because I'm currently talking to someone right now through MPN who transferred from one program to the other because she felt like she was getting abused, verbally abused, whatever, neglected. Went to another program, same kind of thing happening, and now she's just like, I don't know podiatry for me. Bright student, she's an amazing person, but she just really wanted to be at X program that everyone talks about. Now she's out of a job, right? So really, really be yourself. These 3 years can destroy you if you're not at the right place.
And the one thing I really want to make sure make sure you understand how a resident treats another resident that is struggling. Some places would let a person drown before really helping out, or are they gonna catch him quickly or catch her quickly? I've seen it in the program I went to. We had a resident who was struggling pretty much, and the chief residents picked up a lot of the slack, and they just kept on struggling more and more until they eventually had to leave the program because this place, it wasn't for them. Ask, and if I need help, can I reach out to the director, the assistant director, residents, and stuff like that? Because residency is hard. You don't realize how tough it is until you're in it. You might think you're the smartest person in the world, but that first solo call, you are scared. You are terrified you're going to make a mistake. Figure out what residents, and if our chief residents are super active in making sure their interns aren't failing, because you don't want to be drowning because you're already going to feel like that starting day one.
No, that's super crucial. You want to make sure that the residents do get along with each other and support each other through the process, because it's a daunting 3-year process for a lot of these programs. If the residents are not on the same page and they all hate each other and they're not going to help each other out or pick up the slack if someone's has a difficult situation going on, then it's just going to be miserable for everyone around. So you want to make sure you kind of gauge the temperature of the program, either on your month there or just talking to the residents. Sometimes it's difficult if you haven't visited or been there, but it's something that you should try to inquire about, because residency is going to throw you all sorts of different curveballs, and you have to make sure that you have a good support system, not just at home personally. That's important as well, but make sure in your work environment as well, you have to have people that have your back and are not going to let you drown by yourself. In our program, in my program, we had a situation where someone had to take a leave of absence for a month or two. He was potentially thinking about quitting because it was just so difficult for him in the beginning. And we made sure that we all split up the tasks amongst ourselves when he was away. Even the third years did. And, obviously it's not something that you want to do, but it's something that you do for the sake of the program and to make sure that the program is staying upright and you have that supportive environment there, even though it's going to be difficult. You want to be independent to an extent, obviously, to learn, but you also want to have the support system behind you to make sure that you're being encouraged to kind of get through the process that everyone's kind of been through, and if you do falter, you have people there that are gonna, help lift you up.
Yeah, that's huge. Having a good the class that's coming in with you, if they have your back, it makes the days a little bit shorter.
Yeah, and last thing I want to, well, not so much a question, but just say is just like I think at the end of the CAS for CRIP interview process, I think there's a survey that goes out, right? Like I think you're supposed to review or rank or kind of talk about your experience, right? And you have an opportunity to talk about things that made you uncomfortable, right? So if anyone's asked any questions that made them uncomfortable, you should absolutely report these people, right? Example I can give you is this happened at my program. I was actually there. There was a candidate that had a 2-year gap in her podiatry school. And one of my attendings is like, why were you out for 2 years? Okay, sure, you can ask that. She said, oh, it's a medical excuse. Okay, end of story. You don't inquire further. If an attending goes and starts inquiring why you're out for 2 years, and she's like, oh, I have colon cancer, and then she starts crying, right? That's a really bad look on that program, and that's something that probably should be reported, right? People don't need to know things like that about you. And obviously, I mean, I don't know what the situation is now, but if someone's asking, how do you feel about the situation in Gaza and Israel, and oh, how do you feel about Hamas and this and that, you don't really need to be asked stuff like that, right? Being asked political things, oh, how do you feel about Trump? That's one thing, but being asked about something that's divisive like that, right? Know what you're allowed to be asked and what you're not allowed to be asked. I guess that's kind of my point.
Just to build on that, there is a lot of pro-Israel people in podiatry. So even as a resident, you have to tiptoe. I can 100% where I was, there was a good chunk of those pro-Israel ones. As soon as they started talking politics, I was super quick in trying to change that subject or just figure out some way to not bring it up. You don't want to bring that up in a professional environment. It's not going to be beneficial for you. We have all our views. They have all their views. You just have to be careful.
All right, guys, that's all I have. Does anyone have any other questions otherwise?
Just if I could make a comment about that last point you guys were making. So for a lot of us Muslim students, 95% of our application is community service in masjids and local community centers, and it says Muslims for Peace all over the place and stuff like that. So a lot of these places that I'm applying to, I noticed myself that maybe the program director or very specifically high level people in that program are maybe leaning in that political direction. So should I be changing my application for that? What is the way to kind of express my individuality and my pride as a Muslim, and also to not remove myself as an applicant in those programs? Because I would say maybe half of my programs right now that I am applying to kind of demonstrated that to some extent.
I can be honest, I don't think my program director has ever brought up volunteer work during the interview process. It was more about how the student and extern was vibing with the residents and the academic stuff. But that could be different in your guys' opinions. But I don't think I've ever heard this person volunteered here. That was never, ever came up in conversation to us. Maybe the attendings were doing it on the back end, but they never asked residents.
Okay, thank you.
Yeah, I wouldn't change anything on your CV that's related to volunteering, because at the end of the day, they can always refer back that you're volunteering for a good cause. It doesn't matter who's sponsoring it or what organization you're doing it under. You just talk about the experience itself. If you're volunteering at a health fair underneath a certain Islamic organization, then there's no reason to leave that out. You just talk about the values that the organization may potentially present and then live by, and you're volunteering and providing a service to the community. You don't really need to go into any tangents when it comes to relating to like politics and all that. I mean, you know what you're doing. You have the right intentions, and you're doing your volunteer work to benefit other people. So just essentially leave it at that and try to focus on that stuff.
Yeah, so if I were to answer your question, I agree with what both Uzair and Rafay said. Don't change your application because if you did good work, you leave it there. In terms of, I kind of get what you're saying. Like, you're a little bit worried that maybe someone will discredit you or not consider you because you're Muslim, right? That's more of kind of what you're concerned about. So in that case, it's a win-win for you. You know why? Because if you're good, then you're good. It doesn't matter what you have on there. And even if you have a Zionist director or whatever the case, you'll find a lot of them, they actually can separate kind of like professional from political. You'll see that. They don't really hold that against you. If they don't hold it against you, then hell else, you're fine. But if you have someone that holds it against you, that's your benefit, because you don't want to be there. Because if they're already discriminating against you now, that's going to continue 100%, and you don't want to be there. So that kind of goes along with my point of kind of just being yourself, right, throughout the process. And, inshallah, it's going to work out for you. So definitely leave that one in there.
Inshallah khair. Thank you, guys.
Absolutely. So yeah, I think you just joined us. The actual content just finished, but we're just doing a Q&A before we wrap up. Do you have any questions, or does anyone have any other questions specifically about interviews before we kind of wrap up here?
Assalamu alaikum, everyone. I'm so sorry. I think I got confused about the time and just logged on. But it's recorded, right? So can I get the link later on?
Yeah, it's recorded. Absolutely.
Please. Oh, okay. Thank you so much.
And for me personally, you can email me if you want it. Feel to ask for it. I'm super available to talk to any single student that wants to talk about interviews or stuff like that, or go through cases. That was some of the funnest times during residency, trying to teach students about cases. So I'm always willing to take some time out and talk.
Yeah, hopefully you guys signed up for the mock interviews that MPN has been offering. And we'll obviously reach out to you guys individually to schedule that. But if anyone else wants to have any other opinions or questions and wants to ask us, feel free to definitely reach out to any of us. And we'll be glad to help and give back to the student body and try to help you guys have a beneficial interview process and land at the program that you're meant to land at.
All right, guys, excellent job. Jazakallah khairan, everyone, for joining. It was very beneficial, even for me, kind of going back to these memories. Assalamu alaikum, everyone. Take care.
Awesome.
Thank you, everyone.